Hearing of the public. This is a time during this meeting where we can hear from the public. Is there anyone from the public wishing to speak to the board? Hearing none, moving to item number 5, request to approve. 5A, requesting approval to release a request RFP for an infant mental health services. Is there a motion?
So moved. Support.
Motion by Antoinette, support by Donna. By Megan. Thank you. Adam.
So infant mental health is a specialty service for children that are not yet born up into their 4th birthday. We have some capacity issues that we are trying to address. This is a specialty service that requires a good amount of training, so we want to look for some more providers that could come in and provide this for the members on our network.
Thank you, Adam.
Welcome.
Any questions for Adam? Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5B, requesting approval for an RFP for the jail diversion services. Dave, or is there a motion?
So moved. Or support.
Motion by Dana and support by Antoinette. Antoinette. All right. Motion by Dana, support by Antoinette. Dave?
This program will allow, it'll be an extension of the continuum of jail diversion services. So it will not interfere, replace the system we currently have in place with community corrections. This would allow us to have a residential component in the community that would allow certain individuals to be diverted while receiving appropriate supports in the community, including some case management, some skill building services, employment assistance, and things like that. So it's needed. It's a missing part of our current continuum, and we're interested in seeing who responds and getting the detail on that in front of the board.
Any questions? Phil?
Thank you, Mr. Chair. That's with Community Corrections, right? Is that what are we partnering with them, or is this something different?
Community Corrections currently has a program in place. This would be like part of that continuum, so they would be involved. I did speak with Nick earlier today, and he sends his apologies for missing this meeting. But yes, we would, further in the process, we'd be meeting with the judges, the community corrections, some other community partners to make sure everything's, all the pieces are in place as best as possible.
Thank you. Thank you, Mr. Chair.
Linda?
But this is us, not community. Have you talked to the sheriff's office? Is our sheriff involved, or to divert from his jail?
They will be, yeah. Like I said, as we go forward and get more information, yeah, the community corrections, the sheriff's department, the office of the county executive, we'll work with all those players, and we're interested right now. It's almost in seeing what kind of applications we get, what kind of programs are out there, and what best suits Macomb County.
Any other questions?
I have one other question. When are you guys hoping to maybe have this kind of up and running? Is there any kind of timeline?
It's real broad. I would hope sometime next year. Like there is a program up and running in Wayne, and our community corrections is sending some people there, but it's down on Jefferson, so it's not geographically convenient. And we do, like I said, the needs here appear to be more than sufficient to support our own program.
I have a question, Dave, about why do we have the RFP for Wayne County in here?
Staff error.
Oh, okay. Okay, any other questions? Okay, all in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5C, request to approve voluntary special assessment. Dave.
The board has received numerous emails from the Community Mental Health Association. They're asking for special, that each of the regions, the CMHs, the PIHPs, provide additional funds to support their efforts in Lansing. So it's a special assessment. They are willing to invoice us, and we have checked with finance, and we do have local funds available. There's a difference of opinion statewide as to whether or not Medicaid dollars can be used. To be on the safe side, the local dollars are clearly available without any strings attached or concerns to that. So it's up to the board whether or not you wish to participate, and if so, to what extent. Last time I heard from Bob Sheehan at the association, they were up to about $198,000, with the average contribution being $20,000.
Is there a motion? I know Dave started talking without a motion, and then is there a motion?
Can I ask a question? Are we making a motion?
The motion is to just, not for the amount, just to carry it forward to full board, but I guess I'm just looking for a motion so we could talk about it. Yeah. Move. All right, move to approve Megan, support by Lori. Okay. And then I think Phil had his hand up first, then Donna. Okay.
Thank you, Mr. Chair. Dave, can we get a breakdown of the contributions per unit as to dollar amounts so we have an idea of, what everybody's given so far? I know we have a total. No? Yes? Maybe?
We can always ask. That level of detail has not been shared in the meetings I've been in attendance at, but it came out as on average.
If we can get that, I would like to see that.
I'll ask Bob.
Thank you. Thank you, Mr. Chair.
Donna?
So is it my understanding that we're just voting tonight on the motion, but we're not voting on an amount tonight? We'll vote on that at full board? Is that what you're saying, Alan?
Well, I suppose it depends on what the motion was. The motion was just to move it forward to full board. We could leave that I think that's within our rules to leave that discretion at full board.
So we'll just vote tonight that we'll
Consider it at full board.
consider it, and then at full board, we'll decide on an amount.
We'll decide an amount and if whether we'll do it or not.
Okay. I just want to understand what.
Yeah.
I wasn't sure either, so, good question, Don.
Are there any other questions or comments?
One question. What was it, the dollar amount? A dollar amount's not coming before?
The average dollar amount was $20,000
Right,
per.
right. But what would be wasn't there a formula based on our previous assessments? Okay.
Not that I recall seeing.
Phil?
Sorry. So if we're close to 200,000, I'm doing quick math in my head. If we're close to $200,000 and the average you said was $20,000, so that's 10 contributing 20,000 a pop. Are there? Like I said, I'm trying to do math in my head. It just seems like there should be a lot more in the coffer, I guess, is what I'm saying.
Right, there's 46 CMHs and 10 PIHPs and 3 that overlap, so there's 53
Okay.
entities able to contribute. A lot of them have to go through the board process such as this. I do know, I heard Bob present and it was 158, and then I heard Bob present shortly after, it was 198. So it is a moving target. But I can ask for the specific breakdown, whether or not it's based on overall size revenue or not.
Thanks for continuing my thought. Thank you, Mr. Chair.
Any other questions? I do have one for you, Dave. In my private work, I did some legal research on behalf of a city and also on behalf of a school district regarding giving, for the school district, remember, it's whether a school district is legally able to provide funds to lobby on behalf of a millage. And that answer is no. We cannot use public money to lobby voters or the legislators. I know I asked, was Aaron ever able to get back to us on an answer on that issue?
Not, there's no final answer yet, and I will go back. The association's done a lot of work on the legal front and has shared a lot of that detail, so I'll share that with Aaron
Okay.
as well.
There's for what it's worth, there's an attorney general opinion on it. Well, I'm willing to talk to Aaron if he wants to talk. So, yes.
You finished your sentence with on a millage, and that's tax dollars. I'm on the millage for the library.
Okay.
So I know, but this isn't to assign tax dollars, additional tax dollars. This isn't a millage bill.
Right, it's not a millage, but it's still public money being used for potential lobbying. I don't know the answer to it, Linda, I don't know. I know it's a close call because you can use public money to educate. You can't use public money to advocate. And sometimes that line gets a little blurry, but it's outside of my lane. I have not looked into this in a number of years. I just know it's a possible issue, that's all. And if we can get an answer before 2 weeks. Okay. All in favor signify by saying, or the motion is to move it to full board? Okay. All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5D, Community Mental Health Services Program Grant. Is there a motion to approve? Motion by Phil, support by Antoinette. Dave.
This is our CMHSP contract for 2022. It's a little over $7 million, which is the general fund amount. The state is looking for it to be signed. I explained that, we have the board process, and if all went well, it should be signed by the end of the month. If they needed it before then, to please let me know, and I have not heard back. But, they were late, obviously, in getting it to us because it's an October 1st start date. But it is what it is. So it's in the eGram system waiting for signature after approval from this board.
Okay. Any questions? Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5E, the CEO contract. Is there a motion to approve the CEO contract?
So moved.
So moved by Dana,
Support.
support by Megan.
Yes, support.
Okay.
I want to make sure I.
All right, and Phil or Megan, do you want to talk about this since Personnel Committee negotiated it?
Sure. It was a very lengthy, we'll call it a negotiation. I want to thank Dave and Megan, especially for all of your hard work with all this. Megan and I sat and met with the exec's office frequently, often, emails flying back and forth to try to keep Dave for longer than a year, but we couldn't get that. But we have him for another year, hopefully. But the exec's office has agreed to this contract. Dave has agreed to this contract, and Megan and I have as well. So hopefully you all do too, so we don't have to do this again. And we do have to approve it by the end of the year because Dave's contract expires on December 31st, and we'd like to keep him. Well, I'd like to keep him. So thank you, Mr. Chair, and thanks again, Megan, for all your hard work.
Any questions or comments? Thank you, Phil and Megan, and Dave, and Linda.
I want to thank them for, I've heard the stories. And it wasn't an easy job, and Dave, thank you for playing along with it too. And glad to have you for another year. That we wished that it were could have penned you for more years, but they'll do that next year.
It kind of reminds me of that sign you sometimes see, free beer tomorrow, right?
Yeah.
All right, all in favor signify by saying aye. Aye. Motion carries. Receive and file, I don't believe we have anything to receive and file. Item 7, A through E, I know we're going to discuss these at the full board, unfortunately. So is there a motion to approve these resolutions, A through E?
Support.
Motion by Linda, support by Lori. All in favor signify by saying aye.
Aye.
Motion carries. Other possible agenda items, CEO update.
Thank you. And thank you for approving my contract. It is appreciated. Yeah, and a big thank you to Phil and Megan for doing that on my behalf.
It was a blast.
Good story.
Would recommend others do it.
Megan now gives up chairing the personnel committee. If anybody else would like to do that. Couple of things. We have completed our move to our new building. So we are officially at 19800 Hall Road now for the administrative, managed care operations, customer service, our call center are all over there. So we have, we're out of the former administrative office on Hall and the Garfield office across from the community college. Big thanks. TJ was in my office for a moment today. He's deserves a medal for all the work in getting that in place. I've been in recently since I returned from vacation. I went around, talked to staff, and universally it was well received. It's lots of windows, it's open, it's nice to see people in person and things like that. So there's still the work in progress as we continue to polish it up with some signage and things like that. But I encourage you, if you have a moment, to stop by and we'll give you the grand tour. Also, as follow-up to the Metro Region meeting, it was a good meeting, good dialogue, updates from Bob Sheehan and everything. Near the end of the meeting, of course, the Oxford school shooting came up and all the work that Oakland Community Mental Health is doing. We are connecting some of our staff that are trained in the crisis services, and they're coordinating with Oakland to help out. So thank you to Crystal, who was on emails with me today, and those staff were following up with Oakland directly. So we are helping out there. I was in a meeting with Dana, and whatever she needed, I said we're happy to help. We do have the mobile health unit. At the end of that meeting, though, because of the importance of it, we are pulling together a quick meeting. Is it next week, Sandy? Mm-hmm. A virtual meeting amongst Wayne, Oakland, and Macomb. It's basically would be a planning meeting for how the community mental health systems can help address this issue. And then, Ryan, you shared it as well. The U.S. Surgeon General came out about this as a public health crisis, which we kind of all knew, but I don't know if it's good to see at that level or not. But there is definitely a need for some interventions. So the rough plan right now, and this is wide open for changes, would be that this initial planning meeting would then lead to a meeting with the schools, possibly law enforcement, about some tangible interventions and support of the educators, the students themselves, and of course the family members about how to identify, support students, what information should be shared and everything else. So we're kicking it off next week, and we will be putting a lot of time, energy, and resources into this. So I'll continue to provide updates as we go forward. We're also working on our, it's another new acronym for everybody, the DCOs. Under our CCBHC demonstration, a DCO is a designated collaborating organization. So in my mind, it's almost like another network of providers like we have under our Medicaid contract. This will be specific to those CCBHC sites. They'll be reporting those services towards the demonstration project. So we had to get the agreement written, and we're working on the internal processes and stuff, but that's moving forward well. The accreditation meetings with the Mahalik group are going well. And again, they will do a readiness assessment. They will basically grade us, score us, as if we were applying for NCQA, and give us those results. They will not be good. So again, I'm just prepping everybody. But we expect that, and they expect that. And once we get those, then we'll start making those corrections, and we'll have a really good idea about how we will score when the actual survey happens. I wanted to thank the staff. The Attorney General's visit at the Crossroads Clubhouse went really well, and I was very comfortable that it would. So I was off, but I left it in good hands with staff and board members, and very appreciative of that. So Adam was there, and then Helen Klingert from the substance use side, and of course Bruce Dunton from the clubhouse, and Phil, our own Phil Kraft, was present, along with Al Lorenzo from the county executive's office. That by all reports, she was very engaged. She stayed for almost 2 hours, and was, like I said, I was so impressed by the way the staff and board members and everybody represented Macomb County Community Mental Health. So thank you very much. Also, the board was meeting about the kind of special programs as part of that work group, and we did put the word out to our providers, and we got a good response. Then I'll take blame for part of that. Is I was thinking we could do some quick agreements with those providers, get the money out the door, help that process grow. But we're going back, and we have to get more detailed contracts in place with those providers so that the paper trail is appropriate. So we're working on that now. So you should expect here at the board, probably starting in January, and probably for a few months after that, you'll be seeing a lot more of these kind of special contracts that came out of that work group. I think there was about 13, when all is said and done, and some are small, some are larger in dollar amounts. But we think they were all the ones that we approved were all important, and we want to get those going as soon as we can. And that's my report for tonight. Thank you.
Thank you. Megan?
Yeah, so I had the fortune of taking both the adult and youth mental health first aid back in 2018. I actually think it just expired in November. I think I let it lapse. But it was really great. I'm actually really happy I did the youth one. It's very similar to the adult one, but I think it talks about some more relevant things that, youth deal with. I guess I was just wondering, I know it's National Council for Behavioral Health that puts that on. Have there been any, not that you would know off the top of your head, but have there been any significant changes since 18, particularly towards stuff like that? Like, I know that the biggest part about the mental health first aid is like suicidal ideation and how to, talk about that very upfront, surprisingly, like very upfront. But is there anything that they've kind of tailored or tinkered with to kind of make it more too about maybe harming others, because that
Not yet.
seemingly
The most recent change was that now it's virtual.
Oh, okay,
So,
sure.
so they do permit that, so we can reach a wider audience, which
Okay.
is good.
It is good.
I would not be at all surprised if the National Council did come out with something.
Okay,
And my thoughts, of course, were as we meet as the metro region, that we probably pull in the National Council as well with some of our plans to see
Yeah.
if they have any
thoughts?
funding
Right.
perhaps, or thoughts, recommendations.
Right.
You know, what's going on in other parts of the country.
Okay,
But since this happened here in Michigan too, I'm confident we'll be able to put together a really good response, a
Okay.
good plan
okay.
that will impact as many people as possible. And I'm
Thank-
sure it will change over time too.
Sure. Thank you.
Dana?
Thanks, Ryan. So I am very excited to hear you talk about that. I actually was gonna say something at the meeting tonight. And my thought kind of was, I think we have good reactive programs in place, but we don't have, anything in place to try to, any preventative program. So and it happened in Michigan, and I think that, we have really good programs here in Macomb County, and I would really like to see us work on something, something like maybe we do training for teachers and students for signs to look for, and then how you handle that, what you do, and I know you can't believe everything you hear in the media, but it sounds like there were signs, a teacher recognized that, but then there wasn't enough follow-up to stop from what actually happened. So I'm very happy that you guys are going to do that, and I would like to see us move in some type of direction like that. And I think with law enforcement getting involved too, I'm a firm believer that the more collaboration we can do, the better it is for everybody, so great job on that.
Yeah, Lori Phillips shared some messages that had gone out to family members, and the sheriff's department had already was meeting with the school staff and things, and some of our local schools. So yeah, that's an important piece. But of course we do have school prevention programs in place. It's just building on those, expanding those. And then of course, when something is identified, having those services available as quickly as possible too. So yeah, it's going to be interesting to see what we're able to pull together regionally and what we already have in place and what gaps we can fill in.
Yes, Linda?
In response to your email today, I raised an issue that I've been talking to different people for about a week, that I would like to see the plan for the future and the needs that Dana talked about and what the region talked about are wonderful, but I think our community maybe needs something immediate, a press release or something on our Facebook, on our website. I would just like to see something for local resources. I think I put in the email today, it doesn't stop at DeQuinder. Oakland County they're having 3 community meetings. I understand it did happen in Oakland County, but Southfield's we're closer to Oxford than Southfield is. We drive through Oxford probably more than Southfield people. So it has a real impact on the mental health of people in Macomb too. So I would like us to brainstorm or give you ideas, or the staff to talk about some kind of immediate kind of response for us to get out the word. If people are in trouble, this is where they can get help.
We did get your email, like I said, and we are working on that message that will go on our website, Facebook. Our communications director is under the weather right now, and it's holding things up just a
Okay.
tiny bit, but we will get that out probably by the end of next week for sure.
Thanks.
Donna?
I think it's wonderful for us to respond, but I think it takes the whole community. School social workers have been removed from the schools because they're not willing to provide the resources to have school social workers in the schools. You hardly ever see school social workers in the schools anymore. They need to start providing those resources again. So, I think it's wonderful that we're willing to step up, but it takes this kind of a horrible situation for the whole community to realize that these kinds of resources are needed. You know, I've told you before, there used to be therapists in the ISD schools, you know. They need to start realizing that this kind of horrible tragedy is a response to that the communities don't take mental health services seriously enough until we have a tragedy like this. And then everybody's ready to throw their hands up and say, oh my God, why? You know, it's because mental health services are needed 24/7, 365 days a year for these kids, you know, not just when we have a crisis like this. You know, this kid needed help and no one was there to help him. That's the problem. You know, he was crying out for help and nobody listened, you know, no one in the community, no one in society. His parents weren't there for him, you know, no one was listening. And the problem is that in all of society, we can't do everything. Schools have to do it. Parents have to do it. The whole community needs to do it. So that's the message we need to get out, is that the whole society needs to start listening to these kids. You know, I did adolescent substance abuse and treatment for years, and I can't tell you how many kids walked through my door. Nobody listened to them. They were time bombs ready to explode all the time. They're out there. There's tons of kids out there like this kid that nobody listens to. And we better start listening. That's all I have to say. We better start listening. And we can do tons of stuff, but we can't do everything. Thank you.
Thank you, Donna. Anything else, Dave?
No.
No? Okay. Just a reminder that we have a recipient rights meeting on December 16th. Our full board meeting will not be on Wednesday the 22nd. Instead, it'll be on Tuesday, December 21st. And now, hearing of the public. This is the second hearing in the public. If there's anyone from the public, okay.
Oh, you got thought you were getting away. How much time do I get?
Believes
2 minutes? Talk fast, right? Oh, I gotta write my name first? Good evening, Lisa Lapine, Kirk of Macomb, also Harrison Township resident. I want to say first, thank you for supporting the infant mental health services RFP. Lots of folks that I support, my guardianship program, have babies and they need help learning how to take care of their babies so their babies can stay healthy and they can stay healthy doing so. Thank you. Thank you for supporting the RFP for jail diversion. Got lots of folks who need jail diversion. Lots of them, right, Adam? Lots of them. So I'm really excited about that. Request to approve voluntary special assessment. The only question I didn't hear is how they're gonna use your money. You know, it might be really worth whatever dollars you give them if you know what they're gonna pay for. Because quite frankly, if they're talking about paying DSWs or direct support professionals more money, wow, that's worth paying lobbyists for, right? But if they're gonna lobby to increase the funding for administration, that's a different question. So I really hope that we'd have some conversation about what's our money going toward, no matter how much money they're asking us for. I'm sure you guys have those conversations, but for me sitting out here, I don't hear that part. But it's one of the things that I'd like to hear, like if we're gonna pay this money out, what's it going for? Because I can be highly critical when I don't have information. And you all know that, right? Information's power. The other thing I'd like to mention is you guys really need to look at the rates that you're paying providers. The tri-county areas kicking your tail. We can't keep, even if we could hire staff, we can't keep them because your partners in Oakland and Wayne are paying us more. And our staff doesn't want to work here because they want to work in Oakland and Wayne where they're going to get a higher rate of pay because the providers are being compensated better for everything. For day program services, CLS, you name it, insert it. Wayne County just passed down a 5% increase to all providers today, and they were already paying more for the services that we are providing here. So we can't get staff already because we can't pay enough, and we can't keep staff if your partners are paying more than you guys are paying. So really would encourage you to take a look at those rates. And then the last thing I would also mention, or the only thing I would also say is about, we talked a little bit about what's going on with Oxford and all of the challenges that we're having about mental health services. And I had a really great point to make, and it just went out of my head. Give me 7 seconds to recall what it was. oh yeah, mental health stigma. Every time something like this happens, mental health takes a hit. That kid and what happened and everything is an absolute tragedy. Those families are struggling. But every time this happens, people are afraid. And we have to work on the stigma. Why does that make me sad? It does. But we have to work on that stigma because the people we serve suffer more. Because more people are worried about helping people with mental illness. Because families are hurting because of what happened to their kids. And there's, thank you, Lori. Families are hurting because of what happened to their kids. But saying that someone is mentally ill then means that someone with mental illness could do that to your child. And so the people that we serve suffer. People you serve suffer. And lots and lots of folks with mental illness will never do anything like that. So many people will never do anything like that. But the difficulty is, it's really hard for people to distinguish that when they don't do this every day, when they don't know not to be afraid. So we really, really have to look at that messaging, I think, a little bit too, because I agree with everything that was said. We gotta help folks with mental health issues. We gotta make sure that they're feeling safe. But there's a other piece. The community needs to know that people with mental illness don't need to be feared. And that's gonna be a problem coming out of this, at least in my opinion. Anyway, one more time, your rates are less than the tri-county area. We can't keep staff. That doesn't even make me cry anymore, because that part is just a reality that we're facing here in Macomb. We're putting together from the Provider Alliance some numbers for Mr. Pankatai so he can see the struggle that we're facing, because I'm only a Macomb County provider. If you guys don't fund me, I don't do business. So that's a different thing for me. But when you take a peer of mine like ABC Company or DEF Company, and they've got staff in Oakland County, they're not choosing to staff your homes. And Adam and I have the pleasure of working with a serious number of people who can't get from the hospital into placement. And we both know a lot of people who can't get into group homes because the group home can't find staff. So, program a budget, take a look at those dollars. Can't encourage it enough. Thank you very much. Merry Christmas. See you at board meeting.
Thank you. Is there anyone else from the public looking to speak? Going once, going twice. All right, item number 10. Is there a motion for adjournment?
Motion to adjourn.
Motion by Lori and support by Megan. All in favor signify by saying aye. Aye. Motion carries. We are adjourned. Thank you.